So I would knock. Hi, I'm Brandy. I'm your nurse today. We're going to be doing a subcutaneous injection. I am going to do my general principles and safety practices, as well as my 11 rights and 3 checks. I would provide privacy for my patient, and I would do my hand hygiene. Putting on gloves. I would use the 2 identifiers to identify my patient. Can you tell me your name and date of birth, please? Okay. And I would check that with the wristband. And that is a match. So I would ask my patient if they had any allergies, and I would assess the area and do assessment for whatever the medication's for as well. So with the subcutaneous, you can do the back of the upper arm between the shoulder blade and the elbow in that fatty back area. You can do the abdomen with staying away from the belly button, below the costal space, and above the iliac crest, usually an inch to 2 away from the belly button. You can also do the upper outer middle of the thigh, as well as the upper back in between the scapulas, in that fatty tissue, or the lower back in the upper gluteal area. So with a subcutaneous injection, you would use a needle that is 3/8 to 5/8 inches long and 25 to 30 gauge. This is a 27 gauge ½ inch. So that is within the rights. I would open my needle. And have my medicine here. I would be doing the 11 rights and 3 checks, making sure that this is the right medication and patient and all of that. And I would take a alcohol prep pad, and I would clean the top of my vial. Let that dry, not fanning, not bluffing, anything like that. I will take my syringe in my dominant hand and decap. Decap it and put my needle into the vial, making sure the tip of my needle stays below the fluid level in the vial and not to touch the plunger on the inside, I would draw down on the vial or on the plunger till I got to the right dose of medication. So 0.3 mLs on this. And then I would withdraw my needle, placing it inside the cap. I would then take another alcohol prep pad and find the site I'm going to use. So if I'm using the back of the upper arm, I would take and do a circular motion, working my way outward, allowing that area to dry, not fanning, not blowing on it. I would then again pick up my needle and remove the cap. And I would inject at a 45 to 90 degree angle. I'm going to do 45. I'm going to hold the needle still and slowly push the injection or the medicine in. And I'm going to quickly remove it at the same angle. So at 45 degrees that I had injected it, I remove it at the same angle. I do not recap my needle. I engage my safety and I discard it in a sharps container. And I would place a gauze on the site, not massaging, not applying pressure. And then I would reassess my patient for whatever the medication was supposed to be doing, and also the site, making sure that everything looks well there. I would remove my gloves and I would report and record.